I hear this in my clinic almost every single week. A patient sits right where you are. They are 65, maybe 75 years old, and they are clutching their knee or rubbing their hands together. They look at me with a mixture of frustration and genuine fear, and they say, "Doc, my joints are completely shot. The pain is there every morning when I wake up. I can't garden anymore. I'm terrified of going down the stairs. I guess my body is just wearing out." If you are over the age of 60 and living here in the U.S., I know that maintaining your independence is your number one priority. We don't want to be a burden to our families. We don't want to be confined to a chair. And right now, the single biggest threat to that independence isn't just cognitive decline or heart disease. It is the slow, agonizing progression of osteoarthritis and joint pain. But I am here to tell you something that might shock you. The biggest thing you've been told about your joint pain, the idea that your joints are like the brake pads on a car, just wearing away from decades of use, is a complete biological myth. Welcome back to Health and Well-Being. Today, we're going to do a deep dive, a full clinical masterclass, into the actual science of your joints. I am going to explain exactly why your knees, hips, and hands are hurting. We're going to uncover the hidden, silent destroyer of your cartilage that most doctors don't have the time to explain. And most importantly, I am going to give you a science-backed, step-by-step protocol to stop the degradation, reduce your pain, and reclaim your mobility. Grab a pen and a piece of paper, because this information could very well be the difference between spending your 70s and 80s in a wheelchair or spending them walking in the park with your grandchildren. The wear and tear myth and cartilage starvation. For decades, the standard medical explanation for osteoarthritis was simple: wear and tear. We pictured the joint as a mechanical hinge. We believed that after 60 years of walking, running, and lifting, the smooth cartilage protecting the ends of your bones simply wore away from friction, leaving bone grinding on bone. It makes logical sense, right? But the clinical data tells a completely different story. If osteoarthritis was purely caused by wear and tear, then long-distance runners, people who pound the pavement for thousands of miles a year, would have the worst knees in the world. But massive epidemiological studies show the exact opposite. Recreational runners actually have a lower incidence of knee osteoarthritis than people who sit on the couch all day. Why? To understand this, you have to understand how cartilage actually eats and breathes. Unlike almost every other tissue in your body, your articular cartilage does not have its own blood supply. It has no veins or arteries pumping nutrients into it. So, how does it stay alive? It survives on something called synovial fluid, a thick, lubricating liquid inside the joint capsule. Your cartilage acts like a dense, wet sponge. When you put weight on your knee, you compress the sponge, squeezing the old, waste-filled fluid out. When you take the weight off, the sponge expands, sucking in fresh, nutrient-rich synovial fluid. Slow, deliberate pacing. Movement is not destroying your joints. Movement is literally the mechanism that feeds your joints. When you stop moving because you are afraid of pain, your cartilage stops pumping that fluid. It dries out, it becomes brittle, and it begins to starve. The real culprit, adipokines and systemic inflammation. So, if movement isn't destroying the joint, what is? Why do so many older Americans suffer from this? The answer lies in a medical breakthrough that has completely revolutionized rheumatology over the last 10 years. We now know that osteoarthritis is not a mechanical disease. It is a metabolic and inflammatory disease. Let me explain a phenomenon that baffled doctors for years. We know that being overweight increases the risk of osteoarthritis in the knees and hips. We used to think this was just gravity. More weight means more mechanical pressure. But here's the catch. Obese individuals also have a drastically higher rate of osteoarthritis in their hands and wrists. You don't walk on your hands. There is no extra gravitational pressure on your wrists. So why are those joints degenerating? The answer is something called adipokines. For a long time, we thought body fat, specifically visceral fat, the hard fat that sits around your belly and organs, was just stored energy, a dormant savings account of calories. We now know that visceral fat is actually a highly active endocrine organ. It constantly secretes inflammatory proteins and hormones called cytokines and adipokines directly into your bloodstream. when you carry excess visceral fat, or when you eat a highly processed, sugary diet, your body is in a state of chronic, low-grade systemic inflammation. These adipokines travel through your bloodstream, into your joint capsules, and they biochemically attack your cartilage. They signal your body's immune system to release enzymes called matrix metalloproteinases, and these enzymes literally eat the cartilage away from the inside out. Your joints aren't just wearing down. They are being biochemically dismantled by an inflammatory fire. The protocol, movement is medicine, rebuilding the joint. Now that we know the true enemy is inflammation and cartilage starvation, how do we fight back? How do we rebuild the joint? Step number 1 is targeted resistance training. I know exactly what you are thinking. Doc, it hurts to walk to the mailbox, and you want to exercise? Yes, because resting a degenerating joint is the fastest way to guarantee you will eventually need it surgically replaced. We have incredible clinical trial data on this. A major review of exercise therapy for osteoarthritis showed that resistance training, specifically strengthening the muscles around the joint, radically reduces pain and improves function. Think of your knee. The knee joint is supported by the quadriceps muscles on the front of your thigh. If you sit for most of the day, those muscles atrophy. They shrink. When you stand up, your knee joint takes 100% of the shock. But if you do specific, slow resistance training to build the quadriceps, those muscles act like massive shock absorbers. They take the load off the cartilage. Furthermore, the physical act of contracting the muscle and putting controlled load on the joint forces that sponge effect we talked about earlier. It forces the inflammatory proteins out of the joint capsule and pulls fresh, healing synovial fluid in. If you have severe OA, you don't start by running. You start in a chair. You do seated leg extensions. You do aquatic therapy where the water removes the gravity but provides resistance. You work with physical therapists to find a pain-free range of motion, and you load the joint. Movement is medicine. The protocol, starving the fire and the power of curcumin. Step number 2 is putting out the biological fire through what you put in your mouth. If osteoarthritis is driven by systemic inflammation, then popping an ibuprofen every morning is just a Band-Aid. NSAIDs like ibuprofen mask the pain, but long-term use in older adults destroys the gut lining, spikes blood pressure, and damages the kidneys. Instead, we need to alter your biochemistry. First, we cut off the fuel for the inflammation. That means drastically reducing refined sugars, high fructose corn syrup, and ultra-processed seed oils. These are the foods that trigger those fat cells to release cartilage-destroying adipokines. Second, we bring in the heavy artillery. And I am not talking about glucosamine and chondroitin. While popular, massive meta-analyses have shown they often perform no better than placebo for severe pain. I am talking about curcumin, the active compound found in the spice turmeric. Recent systematic reviews and meta-analyses of clinical trials have provided staggering results regarding curcumin for knee osteoarthritis. Studies show that a high-quality, highly bioavailable curcumin supplement significantly improves WOMAC scores, which is a clinical scale we use to measure joint pain, stiffness, and physical function. In fact, several rigorous trials found that curcumin extract was non-inferior to NSAID pain relievers like ibuprofen. Let me translate that. Curcumin reduced the pain just as effectively as a pharmaceutical drug, but without the dangerous gastrointestinal and cardiovascular side effects. How? Because curcumin works at the cellular level. It downregulates a protein complex called NF-kappa B, literally turning off the genes that produce inflammatory cytokines inside your joint. Clinical summary and outro. Listen to me closely. Getting older does not mean you have to resign yourself to a life of chronic pain and a walker. Your body is incredibly resilient, and your joints desperately want to heal. Stop buying into the wear and tear myth. Understand that you are fighting an inflammatory fire. Lower that inflammation with a clean, whole food diet. Consider a clinical-grade curcumin supplement. And most importantly, do not be afraid to move. Strengthen the muscles around your joints. Feed your cartilage with that synovial fluid and reclaim your independence. I have placed links to the medical studies and clinical trials I referenced today down in the video description if you want to read the science for yourself. Thank you for spending this time with me today on health and well-being. If this masterclass gave you hope and a clear path forward, Please hit the like button, subscribe to the channel, and share this video with a friend or family member who is struggling with joint pain. Until next time, keep moving, stay proactive, and take care of your health.